Hello and very good morning to our lecturer, Dr. Aziz. Today our group will be presenting about the workforce density and distribution of physiotherapists in Malaysia. Before that, I would like to introduce you to our group members, which is ZAHIDAH, NURSHAHFIQAH, FAIQAH HAZWANI, and including me myself, FATIHAH AMIRAH. These are the topic outlines for this presentation. It will start with introduction, followed by the issues, and then the recommended solutions, and ended with conclusion.
Today I'm going to present about the introduction. So what is physiotherapist? Physiotherapists evaluate, create and carry out rehabilitation programs that enhance or restore human motor capabilities. They use a variety of physical therapy including movement, ultrasound and other methods. They might create and implement programs for the early detection and treatment of prevalent bodily conditions and diseases. It is known that 1 in every 3 people in the globe might benefit from rehabilitation at some time over the course of their illnesses. According to Malaysia Physiotherapists Association, they predicted that Malaysia will face a shortage of physiotherapists in 2020 onwards due to population growth in Malaysia. From the chart, we can say that every part of Malaysia has at least a minimum of 1 physiotherapist in every state. The latest data by the Malaysian Ministry of Health in 2020 shows a slightly rising number of physiotherapists in some of the states in Malaysia. For example, in Johor, in 2019, the number of physiotherapists was 112. Then, in 2020, slightly increased by 6 to 118. Not only that, but some states have been decreasing in numbers for the past 2 years, which is in Wilayah Persekutuan Kuala Lumpur and Wilayah Persekutuan Putrajaya. The highest numbers of physiotherapists on duty is at Sabah, Sarawak and also Selangor, with over 100 respectively. Next is the number trending of employment of AHP workforce in the Ministry of Health for physiotherapists is demonstrating decreasing for the past 4 years, where in 2015, a total of 90 people were appointed, decreasing to 26 in 2016 and decreased again to 25 on that year, and followed by the 2017 with 69 people and decreased again to 27 in 2018. Next, I will pass to the next presenter.
Based on this research, this disorder has an impact on person's psychological and social well-being. The same goes to the physiotherapists in Malaysia. Work-related musculoskeletal disorder (WRMSD) in a condition when the performance of labor duties and work surrounding cause damage to muscle, tendon, nerves, ligaments and soft tissue. Physiotherapists practicing in Malaysia frequently experience work-related musculoskeletal disorder. For the past 12 months, case of WRMSD has been reported among physiotherapists in Malaysia. Work-related musculoskeletal disorder are also closely linked to weariness, which is lower effectiveness and contribute labor turnover among employees. This is a factor of why physiotherapists in Malaysia shortage was. As reported, physiotherapists have developed work-related musculoskeletal disorder with more than 89% over the period of their careers and practices and for the first 5 years of practice. This community has a strong need for physiotherapists, and Malaysia's small number of physiotherapists are 2 potential causes. Since there are only ratio of 1 to 13,000 physiotherapists for every individual living in Malaysia, there is indeed a lack of physiotherapists there. A normal physiotherapist must take care of 15 to 20 patients every day. The increased workload in this case could put a tremendous amount of additional stress on physiotherapists. Physiotherapists who don't get enough rest become burnt out and increasingly susceptible to work-related musculoskeletal disorders.
Okay, I will be explaining about the second issues, which is burnout among physiotherapists. First of all, burnout is a type of exhaustion caused by prolonged emotional imbalance in which the burden of perceived stress is overwhelming and exceeds personal resources or coping strategies. It was regarded as a source of occupational hazard. And recently, these exertions were also noted in relations among healthcare professionals, especially physiotherapists, that lead to the shortage of these specialists in Malaysia. Burnout has become a very common issue in healthcare organizations, and it has been studied in a wide range of professional groups, yet very little research has been conducted into the causes and effects of stress among practicing physiotherapists. Also, the result shows that the physiotherapists who perceived their studies as stressful during their training period had high levels of stress of work. This is worrisome because it could increase the future of burnout syndrome if nothing is done to prevent it. This showed that a lot of physiotherapists is harmed by this and made them have low motivated and somehow quit from becoming a physiotherapist. This also could be seen in how the statistics from physiotherapists in Malaysia were decreasing in the recent year. It also because of many issues around healthcare, and the most notable one is burnout syndrome. It may be concluded that the overall levels of burnout among the Malaysian physiotherapists is still within the adequately management level, but still need to be taken care of. Therefore, certain measurement is needed in ensuring the issues that occur in healthcare are resolved.
Moving on to the recommendation solution. Based on those issues, there are 3 recommended solutions that can help to solve that problems. First is by doing ergonomic training programs. This is because this program works as an early prevention step so that workers are aware of proper posture to maintain while on their job. A study recommended by Lin 2017 stated that interventions of training in ergonomics reported a significant decrease in pain and also work-related musculoskeletal disease injuries, especially in the neck area and shoulder area. Therefore, it is recommended that collaboration in handling patients could prevent the development of professionals' work-related musculoskeletal disease. Secondly, adopting technology. By adopting technology in intervention, work-related musculoskeletal disease among physiotherapists can be reduced. This is in line with previous literature by HAZWANI 2018, which found a reduction of work-related musculoskeletal injuries and pain among healthcare providers through a mechanical patient handling. For an example, the use of machines such as powerful body sling lift in transferring stroke or paralyzed patient could save energy and prevent weariness of physiotherapists. Lastly is the employment of assistant. The employment of physical therapy assistant need to increase to reduce workload of physiotherapists that make them burn out. According to a research by Gatsby and Salt, physiotherapy assistants could deliver effective rehabilitation just as well as physiotherapists could. Therefore, the government has an important role to play by offering more employment opportunities for physiotherapy assistants to support the importance of delivering effective physiotherapy.
Thank you, Amirah. To summarize, work-related musculoskeletal disorder and burnout among physiotherapists have unintentionally resulted in an imbalance in therapy supply to patients. The workloads in physiotherapy themselves are heavy. Therefore, A few direct measures and recommended solutions must be taken seriously to overcome the issues of shortage of physiotherapists in Malaysia and prevent them from becoming worse in the future.